Hello, everyone, dialing in from all over the world. Thank you so much for joining today for this conversation on chat for impact in the time of COVID. I'm Catherine Cheney, and I'm a reporter at DevX, which you may know as a media company focused on global development. As our West Coast reporter based on the West Coast of the US, I write a lot about technology and philanthropy in global development, and I'll be your moderator today. So recently I wrote a story about why and how NGOs are turning to chatbots. And I'm excited to dive into this topic today. We already have some attendees typing in the chat how they are using messaging apps and chatbots during this time when a lot of the in-person services you may have focused on in the past are impossible. And one of the key questions that I'm curious to follow today is, even as in-person programming becomes more doable, at least with masks and from a distance, what about the power of messaging apps and chat have these organizations learned when it comes to reaching people at scale? What has actually been really valuable about that technology? And what have we lost in terms of what can only be done in person? So really curious to hear from our panelists about that. Just wanted to start with a few housekeeping items. So if you have the ability to unmute, we ask that you do stay muted when you aren't speaking, just so we don't have background noise. I also really love to see the engagement already happening in the chat function. So please keep it going. And we ask that you use the Q&A function if you have a question you'd like to pose so it doesn't get lost in the chat. But keep the conversation going. It would be fantastic to see some connections made and some conversations continue after this webinar. But do use that Q&A function for questions. We'll get to questions throughout the webinar, so don't save it till the very end. This webinar will be recorded. You can see it's being recorded now. So if you happen to hop on a bit late, or if you want to be fully present and not too worried about taking notes, you will get this recording after the fact. And then finally, we will be in touch with you with that recording via email. If you registered for this webinar, which if you're viewing, you did, you should be in touch with us via email. We'll send that to you as a follow-up. So I want to go ahead and introduce two speakers who are going to kick us off. I mentioned who I was earlier, so if you're just now joining, hello again, I'm Catherine. Two speakers who are going to kick us off who actually conceived of this webinar, brought us together, so really grateful to them for doing that. Gustav Prekelt is the founder of Turn.io, as well as Prekelt.org. And I'll let him tell you a little bit more about their work if you're not already familiar. I know many of your organizations are already working with Turn and have followed the Prekelt model over the years. And Nelly Ramirez is the Vice President for Advanced Digital Services at Fundación Capital. And they're going to talk about why we're doing this Chat for Impact webinar today. So I'll let you take it from here before we meet our other panelists.
Great, thanks, Catherine. And I just want to say thanks. It's amazing to see the community and how many people are joining today for the webinar. I'll keep my comments very brief because we've got like a really amazing bunch of speakers who are going to share the amazing work that they've been doing this whole year. And maybe as just a few opening comments. Firstly, just thanking the speakers who are going to share their work. Over the last, I think all of us, we're getting close to the end of the year, and I think nobody expected this year. They expected the changes in our society, and obviously the challenges that COVID-19 brought. In a time of a pandemic, speed is everything, and I think what all the organizations represented here, and I don't mean just the speakers, I mean the organizations that are on the call as well. What all of you have done is move really rapidly to build features and build services to help the audiences in our countries support and respond to COVID-19, whether it's direct information to end users or information to intermediaries. I think the thing that really impressed us over this year is how quickly the teams jumped on the problem and built these services. So today we're really here just to look back at the last year and look at the things that people have been doing. I think the other comment I want to make is the power of community. What we're trying to provide is a platform so people can use chat to rapidly deploy services, but also they can learn from each other. I've been so impressed this year how people are willing to share with each other and provide help and support on the WhatsApp lines, on the group support that we've been providing. And I think, this is a new medium, or at least the way that we're using it now is a new medium. For the first time ever, it's possible for us to communicate with almost all the users that we want to help. But we're inventing the paradigms and the systems and the means of communication and learning from each other. And just from what we launched with in the beginning of the year, what Andy is going to be sharing with us, and what the team from Breakable.org and from Noura is going to share, just in this year already, we've seen a massive amount of acceleration and iteration on these services. And obviously we look towards next year as the vaccines are rolling out, and we all are concerned, and we all really care about getting the vaccines out in an equitable way and supporting our audiences and our users through not only the primary but also the secondary effects of COVID-19. So I just want to, those are really the only remarks I want to make right now, and obviously to thank
Gustav, you've just cut out for me, but we can come back to you in a moment. And I love this point you made, that we are inventing the paradigm, systems, means of communication, learning from each other as we speak. It's very much still in evolution. So it's a really exciting time to have this conversation. Certainly many challenges this year, but also lots to learn. So Gustav, we'll come back to you. Can we go ahead and go to Nelly and hear some thoughts from you as to why this conversation and why now?
Thank you, Catherine, and thank you, everyone. I'm very honored to be part of this event, and thankful for the opportunity to share and collectively reflect on our experience and the lessons learned in the deployment of chatbots for good. We are convinced in Fundación Capital, and I'm sure it's the case for everyone here, as well as my colleague Gustav mentioned, chatbots have played a crucial role in the midst of the pandemic. In many cases, the only channel that could bring in a timely manner crucial information and resources for people all over the world. This webinar is truly an extraordinary opportunity to share the table with amazing organizations and social entrepreneurs, the panelists, the organizers, and also all the attendees to this webinar, and get a chance to learn from each other and collaboratively open up the discussion to understand the use of these chatbots for goods, what we learned so fast, how we pivoted along the way, and what we see looking forward. In Fundación Capital, we have been investing in technology for development for the past 12 years with different digital solutions to promote economic citizenship. However, last year we innovated with our own virtual assistant with the vision of creating a different approach with our users, which are the vast majority people at the base of the pyramid who live in vulnerable situations, which is the case for over 24% of the world's population. Connector, which is our virtual assistant, we seek to close the gap between the supply of information, products, and services and the demand for reliable and trustworthy information for the population that cannot easily access these opportunities. We truly believe that chatbots have the potential to improve the quality of life and strengthen people's economic citizenship, which is our vision and our purpose. We thank you again for this opportunity on behalf of Fundación Capital, welcoming the participants in the audience to share with us in the context of this global crisis that has certainly brought us all closer. And in many cases, which I'm sure we're going to listen about this a lot during this webinar, it has taken us in a journey of transformation and innovation and closer to our vision of a better world.
Thank you, Nelly. I really think in this moment that NGOs that invested in chatbots before the pandemic, which some of our panelists are certainly examples of that, are finding messaging at the center of what they do now more than ever. And those NGOs without messaging apps, without chatbots, without experience in that realm are really playing catch up. And so I'm curious to see in the chat that in addition to groups that have apps, that are feeling confident about their ability to meet needs from a distance, as it's often put right now, and to use that information to improve their programming, I hope we have groups that are very savvy in this space, as well as groups that kind of feel like they're playing catch up and are really eager to learn from panelists on how to even get started. because I think there will be valuable messages for both groups. So today we're joined by panelists who can share their journey over the past, coming up on 9 months now, building on their work with messaging apps and chatbots to really meet needs during this crisis and perhaps even accelerate their impact. I'm going to go ahead and introduce our panelists, and hopefully you can see them all on your screen. We have joining us Andy Pattison, who's a digital solutions manager at the World Health Organization, and he has helped to put together WHO's Health Alert, which you'll hear about. It's a free automated 24-hour WhatsApp health alert, providing up-to-date COVID-19 information, including the latest global figures, how the virus spreads, symptoms, and treatment. And in addition to the tech, I'm sure he can talk about the partnerships that led to that, including some work with Turn. Debbie Rogers is the managing director at PrayKilt.org, and she can speak to some work that she's been leading in South Africa on Health Check, which is a COVID-19 digital self-assessment tool, and Contact NDOH, which is the Department of Health's COVID-19 response line that she's been working to support. We also have Ludwin Moncada. He's co-founder and head of research at Hora Cero, a chatbot that provides WHO-approved information on the COVID-19 pandemic in Nicaragua. Rodrigo de Reyes is the partnership coordinator for advanced digital services at Fundación Capital, which has worked on what you just heard about, Conector, a two-way virtual assistant connecting people at the base of the pyramid with content, resources, and services to improve their quality of life in the midst of lockdowns. And I believe the geographies represented there are Colombia, Mexico, and Peru, but we'll hear more about that. And we also have joining us, last but not least, Shahed Alam, who's co-founder and president of Noura Health, which partners with health systems in India and Bangladesh to improve the training and engagement of family members throughout the process of care delivery. And they've launched the Care Companion messaging service in India, while also supporting the government of Bangladesh in its WhatsApp-based COVID-19 information service. So before we hear about each of your models, and I've asked our panelists to speak to the problem they were trying to solve, the challenges they encountered in doing so, what learnings they've had so far, and you'll hear from each of them on that. But I just want to start with, what is your biggest learning from this year when it comes to Chat for Impact? Just as a rapid fire way to get to know each of our panelists. So maybe we'll go in the order I just described, and if you don't remember, I can go to you, but we'll start with Andy.
Good morning, good afternoon, and good evening, everybody. For me, the biggest learning for this whole year, with incredible year, has been the incredible solidarity and support that the tech industry has given us, not only to WHO, but to other public health actors. I think we've really seen this amazing movement of people rallying around us throughout the year. With regards to the WhatsApp project, my biggest learning has been the speed at which we were able to get to market. And if I was going to give one thing which really sticks to mind, is launch quickly and iterate often. And that's what we did. We were able to reach millions of people when they need it most in their own language, many of which for the first time WHO has ever spoken to them.
Thank you, Andy. Great advice. We'll go to Debbie. What's been your biggest learning this year?
Well, Andy just stole mine. No, I think I think the biggest learning for me actually has been that the technology itself is not enough. You know, we have rolled out in various different countries and with various different partners, and what goes around making something successful is not just having the content, having the technology, and putting it out there. It's about iterating, understanding how you're talking to people, but also about how you attract people to the platform, how you partner with various people to ensure that there's wide usage and that it remains relevant to people over time. So I think it's really not just, while the technology is a good base, it's everything that goes around it that sometimes makes something successful or not successful.
Agreed, well put. Ludwin, what about you?
Quiet year, isn't it? I think one of the biggest, lessons of this year is that the role of civil society in the problem-solving oriented sort of way, because in the middle of this systemic information blackout that we live in Nicaragua under the past, 13 years, and in this, blackout, like I said, this attempt or this exercise to provide information to people, and especially with an easy to access app such as WhatsApp, it gave away it comes to me like that there are simple solutions to. I mean, it's not a structural solution, but it is kind of a way to solve some problem that the government itself has given to us, right? Like there is the blackout of the information. So I think it is the role of civil society to kind of solve this problem.
Great, and that chatbots and messaging apps can be useful tools in doing that. Thank you so much.
Yes.
And Rodrigo, let's go to you for your biggest learning this year.
Thank you, Catherine. For us, our biggest learning has been our understanding of the digital divide and how high tech and human touch, as we call it, is so relevant right now. We always try to work in our digital solutions by not only using high tech, which in this case would be WhatsApp-based chatbots or digital solutions like apps, but we always combine those with human interaction in which people can have, meaningful onboarding into those solutions so that it's just easier for them. It's more human-centered. So that's something that has changed so much during the pandemic, because before we could do it in person, as you were saying in the beginning, and right now that's just impossible. So we have had to have a call center, for example, that is really, because we go to the base of the pyramid, it's a really special call center that talks to people in a language that they can understand. Because the digital divide is not just about having a smartphone or not having it. It's not just about having connectivity or not having it. It's about understanding that a chatbot can be a way in which you can get information, and that is not really automatic. So this call centers, we call it digital facilitators, help us bridge that divide, and for now it's becoming really an essential part of our strategy.
Thank you. And I know this year has certainly added a lot of urgency, not just to understand messaging and chat and how it can support the social impact space, but to close the digital divide and the many examples of how that translates, because digital access is so critical. Shahed, we'll jump to you in terms of learnings this year.
Thanks, Catherine. And honestly, I'll plus one everything that was said so far. And maybe playing off a little bit, Debbie, of what you were saying, for us, prior to COVID, we always use WhatsApp and tech second. So our in-person training and work that we do was really the primary. And then COVID really flipped that, and we ended up becoming tech first. And throughout this process, what we've been trying to do is really learn, how do we bring in those elements of empathy and support and engagement that our in-person trainings can provide, and then bring that to the tech platform. And I think what we found over the last several months is that it can happen. It takes some intentional design. It takes, testing out things like, play and humor and conversation, and feedback from the people who are trying to serve. And what we've found is some ways to actually make that empathy and that support come in through these products that we're developing, and be really happy to dive into any of those details if it's helpful.
Absolutely. We'll come back to you, but I do recall when I spoke with you for a DevX story on this topic, hearing about some of your skepticism around technology at the outset. And I found it really refreshing, because a lot of people in this space are all about tech for good and ICT for D. And if you don't necessarily feel that way, you sometimes feel out of place. So for NGOs that are kind of moving to chat and messaging out of necessity, or maybe feel uncomfortable about some of the steps they need to take during this crisis, I think it was refreshing to hear you were skeptical at first and kind of had to go on a journey to see how you could become tech first. So we will come back to you on that. I want to dive a little deeper on each of these models, and such a great diverse set of examples we have here. We'll start with Andy, just to hear a little bit more about the WHO's work and the WHO Health Alert I mentioned earlier. So again, going back to each of our panelists, would love to hear the problem you're trying to solve, how you use chat to address the problem, and let's talk about the tech as well as these non-tech elements. And then, any learnings you've had from that journey. I know you kind of gave us a preview a little bit earlier, but as you work through challenges to make this model work, what have you learned, and what can you share in terms of advice? So Andy, I know earlier you mentioned launch quickly and iterate often, but let's dive a little deeper into what that looked like for the WHO this year in terms of chat.
Absolutely. I think that if we can go back to what problem are we trying to solve? I think I would like to summarize that in sort of 3 areas of work. Firstly, we wanted to get more health messages to more people through more channels, right? And in that comes the fight against misinformation and rumors and all the terrible things which come with misinformation. And obviously the goal overall is to bring the outbreak to an end as soon as possible and to save lives. Now, I know that's obvious, but I think it needs to be stated, and it needs to be printed and put on the wall in all of these types of projects, so you don't lose focus, don't get bogged down in the technology, make decisions which are actually going to achieve that strategic goal. So that's the first thing, is more health messages to more people. The second problem we were trying to solve is to sort of bridge the gap for overburdened health services. Some of them, got overburdened very quickly, very surprisingly. In Europe, we were absolutely horrified to see how quickly Italy, a very modern country with a large infrastructure, seemed to crumble under the weight of the outbreak. So we wanted to relieve some pressure off them. And in fact, one of the languages we prioritized was Italian, so that we would do that. When it comes to bridging the gap of overburdened health services, it's interesting to note that on our service, 50% of all Arabic users are from the Yemen or very close to the Yemen. And that shows where health services are lacking or have broken down, people turn to their own devices and look for help elsewhere. The final problem is that we wanted to reach people where they were. Now, we could spend a lot of time and effort dragging people onto our channels, onto our website, or onto our Facebook pages and things like that. But actually what my team has done is turn that strategy on its head and say, rather than trying to bring people into our lives, why don't we get into their lives? So all of you with a smartphone will know that you've probably got about 30 apps on your phone at any one time, but actually on a daily basis, you only use 4 on average. So my job is to see how I get into the 4 on your phone. And WhatsApp, of course, is one of the most used apps in a lot of countries. So that's what I wanted to do. So if you think back to before lockdown, if you're in lockdown working from home now, your journey to work is always the same. You take the same car or the same, in my case, motorbike, and you go to work the same roads to the same office block. You usually take the same lift and sit at the same desk. It's very hard to break that habit. What we're trying to do is, in the digital sphere, it's the same thing. People have a digital journey every day. So we want to get into those 4. Rather than change their behavior, we want to reach them where they are themselves. And I think we've been quite successful using 3 pillars of work. One is to raise good quality content. The second is to fight misinformation, and the third one is to gain user insights. And the user insights feeds into both of these other channels that we're doing here. So at the same time we're raising good content, we have to raise good content because that's the way to fight misinformation. Misinformation will thrive in a vaccine. So that's kind of our approach, is to sort of look at it from the point of more health messages to more people. We wanted to support the ministries of health who are overburdened or were not yet ready. And we wanted to reach people where they were without them having to change their habits.
Thank you, Andy. And great point on reaching people where they are. I know some people have chimed in on the chat about how they're doing that and how WhatsApp has emerged as one attendee put it, the easiest and most cost-effective way to reach people who need their service the most. And then I think, there's that factor of reaching people where they are, but other key questions you also have to ask. I know end-to-end encryption and data security is a huge priority for many NGOs, and some more than others really have to prioritize that, which is another key consideration. So we can get into some of those questions as we go through these examples, but that was a really helpful overview. So now we'll go to Debbie just to hear a little bit more. We got a preview of your work, but key challenges you were trying to solve and how you worked through them and what advice you have as a result of your journey this year.
Yeah, so I think, it's crazy to think it's been about 6 months since we initially launched, because we've iterated on so many things. There have been a number of challenges, and the ones that we had last week were not things that we foresaw in the first weeks of getting our service up and running. I think we started very, very much like Andy did, so I'm not going to go on that very much more, but the initial start was information and misinformation. And I think it was really amazing to have the collaboration with the World Health Organization, by the way, and being able to very quickly find trusted, reliable information about COVID-19 and be able to deliver that to various countries and then optimize for those different countries and into different languages. But we had a trusted source to start with. So that was really amazing from the WHO side. I think the next big problem that we wanted to solve, particularly in South Africa, which is where our focus is, that it was really confusing for everybody as to whether they should test, whether they should self-isolate, where they could test, what the symptoms were, and that kept changing as well. You know, what the South African government decided on for who should test and who shouldn't, I think changed about 10 times in the first few months. And so it was very difficult to get that information through to people. And so what we created was the risk assessment tool, where people can input some demographic information, some comorbidities, and some symptoms, so that they can understand what is the next step, what must I do, and hopefully not, therefore also relieve the burden from the health system by not sending people rushing to the health system when actually there was something else they should be doing, such as self-quarantining. And so that was really, really important for us from the citizen perspective. But what we also knew is that by allowing those risk assessments to happen, we were collecting enormous amounts of data that would help the health system themselves to be able to look at where are the highest risks. Are there any increasing risks in certain areas? And the data can be looked at down to a ward level. In South Africa, we have province, district, and then ward. And that has helped from a decision-making perspective for the South African government to be able to see where they should send resources. And hopefully will also become predictive in the future as we see new waves coming in. And then the third one was really to support health workers with the types of information and services that we'd already delivered to general citizens. They obviously have different criteria for whether or not they should test. They also have different pieces of information that they need. And so we launched services that support health workers specifically. And I think, the numbers kind of talk to the success of it. We've had over 8 million users on the platform in South Africa. It's delivered in 5 different languages. We've delivered over 1 billion messages through interactions with the chatbot. And then from the risk assessment perspective, we have had 1.9 million users who have completed 9.5 million checks, which is an enormous amount of data that I hope is going to be really useful for not just second and third waves within South Africa of the pandemic, but also possibly for other pandemics going forward.
Thank you, Debbie. And before we go to some of our other panelists, I just want to remind attendees to use that Q&A function if you have questions. I also encourage you to use the chat. I see even some of our panelists are answering questions in the chat already, which is fantastic. I love to see that. But for those who are watching this at a later time, they might miss some of the chat. So let's make sure if you have questions you want our panelists to address to everyone, do throw that into the Q&A as well so we don't miss it. But great conversation happening right now in the chat around a major challenge, which is one of our attendees notes. A lot of people in communities we work in don't even have access to mobile phones or use feature phones, so can't access WhatsApp. How do we solve for affordable devices? And Andy was mentioning that there are some options there, and free basics is one option that the WHO has used to reach some of these people because it's a zero-cost data service. But again, keep that conversation going. I love to see questions and collaborations coming together in the chat, and then also throw any questions into the Q&A. With that, I'd love to go to Ludwin, if you can tell us more about Hora Cero and the problem that you aim to solve and how it's going, what your learnings have been.
All right, yes. Well, I think it is important to mention that Hora Cero, it's more like it is a research and advocacy group. We are a political group, right? And as a political group, we realized that COVID was was handled like a political issue too, right? And so we wanted to help in so many ways, but one of the ways was that we were trying to deliver reliable information in as many ways as possible, and the chatbot was, let's say, just one way that we had to do it, right? So we obviously, and of course, had no previous experience in developing chatbots or something like that, right? Like this is not our field or something like that. So the chatbot was I don't know, like formulated by one of our members, Hansel, and it took a lot of work, because in that time when we were delivering this or developing this chatbot, the most of the information was available only in English. So we were trying to translate it to Spanish in so accessible ways, right? And it took a lot of work from translating documents from the World Health Organization and the North American CDCs, and so we were trying to deliver not only reliable and translated information, but trying to also combat the denial or the COVID denial of the government, right? Because the government was also misinformating. It kind of had a between of, yeah, there's some disease going out there, but it's not that dangerous. And so they were not taking any measures really. And we wanted to help to prevent the healthcare system to collapse because of two main reasons. First off, we to this point don't really know the actual infrastructure capacity of our health system. That's one of the things that we lack of data in every field you can imagine of. We lack of public and official data and reliable data. And and the second one, because we learned from Italy and Spain, we knew that the virus was going to spread really, really fast, right? So we knew that the system would possibly collapse. And in this way, the chatbot, it was also combined with some other ways to deliver information, such as a website we created, right? Where we were giving infographics about how to prevent COVID, but more detailed information about how to tell kids about COVID. And we actually had a data comparison between the data provided by our Minister of Health, MINSA, and the data provided by the COVID-19 Citizen Observatory, which is a civil society initiative that we're through a network trying to, like systematize information about how many possible COVID cases were in the territory. So we were trying to contrast the information, and of course, the information gathered by the observatory was way bigger than the MINSA. So we were trying to, like democratize information and help to prevent the spread of the COVID-19 in this blackout, on this information blackout, right?
Thank you. Absolutely. And I do see we have some questions coming in, so excited to get to those. Keep them coming. But I want to go ahead and go to Rodrigo and hear a little bit more about Conector, but also you mentioned earlier the digital divide as a big learning this year, just your understanding of the digital divide and how high tech and human touch is so relevant. So if you can expand on that as well.
Sure. So first, Connector was created to be able to connect people with products and services that can help them improve their quality of life. As citizens, as maybe like us as connected citizens, we can just go to the internet and we know about accessing financial products, apps, getting information for buying houses, or for getting houses from the government, or accessing a variety of services that are improving our lives in a way that people who are in the base of the pyramid just cannot because of the digital divide. And what we tried to solve was how people can access this kind of information in a better way through chat. So what happened in COVID-19 was that we could not provide this kind of products and services. So we made an iteration, as many of us here, and we decided to have more information on our chatbot about health, as many of us here. But as an institution that works in financial inclusion and intimate partner violence prevention, we also felt that we needed to address those issues. 92% of, in the beginning of the pandemic, 92% of our users were losing their livelihoods like right at the beginning. They only have savings for maybe two weeks. Some of them a little longer, but this was not enough, of course, to survive for all this time. So we knew that we needed to give access to information on how to manage their assets better, how to manage their money flow better in this situation, and at the same time keep safe. And also we were seeing that cases of intimate partner violence were just increasing dramatically. So that the impact on women was just disproportionate. So we also put information there on how women could react, like where they could go in case there was violence, but also ways in which it could be prevented. So through, let's say, healthier family relationships at home, especially when, you know, we were just staying at home all the time. It was, you know, it's been hard for everybody to keep their mental health at a good level. So these were the problems that we wanted to solve. The information, we put it there in the household, in the chatbot, and we have been iterating all this information for like normally two week iterations on the content. And what we have been doing also is adding multimedia content so that people get a richer user experience. So we have video, we have images, we have audios that we know that the base of the pyramid reacts better to, because maybe they're not so used to. We have had feedback from many users saying that maybe it's preferable to hear or to see an image than to read text. And this maybe is part of the digital divide that we were talking about. We had to. So we knew that from the past, we have had chat experiences in which we don't have a chatbot. What we used to have I call it human bot. So basically, it's a person doing all the chatting behind the scenes. And we knew from that experience that people needed all this quality content in terms of making it amenable. But when we changed to chat, and given the fact that people were just not used to getting this kind of information from chat, we knew that we had to go back to our premise of human touch. So in this case, human touch was a call center telling people what a chatbot is, how does it work, why it's interesting for them, why it's going to have impact in their lives. And people have actually valued the information really well. There has been really good uptake, but at the same time, it's difficult to get a lot of engagement, and it's difficult for people to come again to the service and check it again. So there needs to be more interaction from our call center to tell people about new content, and that part has been tough. And our opinion is because people are not, because even people, if they value the service, many of them don't understand how it works, and that deters them from, or disencourages them from accessing again and engaging in a way that we would like to see.
Thank you, Rodrigo. And I want to go to Shahed, and I'm curious, I happened to hear this story when we last spoke about some of the work you're doing on messaging apps. You mentioned, I think, a very helpful example of what this looks like before organizations go on this journey, developing chatbots, perhaps working with Turn. You talked about your team started by copying and pasting messages from Excel into WhatsApp and setting reminders to follow up with users, but getting blocked in trying to do so. And I just thought that was such a very useful, concrete example of how this journey can begin. So can you tell us, and maybe we need to go a little bit pre-COVID here in your response. I'm not so sure how that lines up with the timeline. The problem you're trying to solve with your chatbot, and what that journey has been like. And when was it that you were in this Excel stage, and how did you get to the stage you are now?
Sure. Yeah. It's been quite a journey, and just to remind, maybe, the way that we brought in technology and even the need for communication into our program was that after we trained, so at Nora Health, we train patients and their family members primarily to be able to care for themselves once they go home, and do that through the health system. And there's an in-person engagement that happens, and then we leverage and a lot of our focus for the first several years of our work was building those partnerships, was engaging with the nurses that were delivering the training, building the effective content that can actually change behaviors, and building a couple tools that were not tech related, that people could take home to remind themselves what to do. Let's say if they have their first time mother, or they just received a surgery. And so soon we realized that actually most of this behavior change was happening, of course, at home. Most of this care is delivered at home, and how do we really support people at scale? And we're looking at options for being able to do this through technology. And we tested many different things, from IVR, having people actually making phone calls, IVR being the automated voice messages, people actually making phone calls, SMS. And what we recognized when we were making a lot of these home visits to the people that we serve is that while a water tap wouldn't be getting to their homes, they would have access to a phone that would have a few apps, and WhatsApp happened to be one of them.
Mm-hmm.
So we began to just do some testing, and in that very organic way began to essentially with our own phones and our own SIM cards, started to test what would that interaction look like once someone leaves a facility. What kind of information would they want? What type of content do we need to build? And really did this from what began was our phones, and then eventually kind of got it to be a little bit one more step sophisticated, where built out a couple spreadsheets where we had content laid out. It translated into different languages, and then obviously that became cumbersome when we were scaling to more and more facilities, reaching more and more people. And thankfully around that time we were able to engage the team at Turn, and they were also kind of solving for the very similar problem. So for us though, I think we wouldn't have really recognized the need for, and the way where Turn and platforms like that can be useful, unless we just started with the quickest way to start it up, which for us at the time was using our own phones and our own WhatsApp, and being able to send these messages, and then eventually building some of that platform around it. And now those spreadsheets have turned into pretty complex kind of tools that are able to provide our support executives the answers to questions, be able to preempt answers to questions so that they can effectively use their time. So it's been a huge evolution, and honestly, it's all about iteration. And I would say, like Andy was saying, that first step sometimes is the hardest, and just being able to do that as quickly as possible was helpful for us. I'll pause there. Catherine, was there anything kind of related to that you wanted to dive into?
No, that was great. And I'm conscious of timing. We only have about 10 minutes left and some great questions to get to. I'm going to jump to a question that just came in that I thought was really interesting. And I'll open this up to any panelist who wants to jump in. The question is around how chatbots can enable members of the community to talk to each other. So not just organization to, the person you're working to serve, but the people you're working to serve talking with one another. And how do you manage and track that peer-to-peer conversation while maintaining anonymity for security? So who would like to jump in on that? I thought that was a really interesting question. Debbie?
Yeah, so unfortunately WhatsApp, the business API for WhatsApp, which I think most of the organizations here are using, doesn't allow for that. if they, they don't really have any support for groups. And even if you did have support for groups in WhatsApp are not anonymous. You can see the users within that. And so it's not an easy thing to do by any means. There are some ways that we have been experimenting with creating virtual chat groups within WhatsApp that maintain anonymity, but there are a lot of very tricky user experience and monitoring things, as you say, how do you know what is going to happen and what isn't? And I think one of the biggest challenges that's going to be going forward, as probably more people start to look into this type of engagement, is going to be moderation. It's incredibly hard to be able to ensure that you don't have a group that where somebody comes in and is an actor and could actually do harm, and being able to ensure that you can get that person out as quickly as possible, particularly since a lot of the work that we do deals with very vulnerable populations as well as very personal information. And so at the moment, WhatsApp API doesn't allow it, but I think even if it does start to, and even though there are actually some other IP messaging platforms which do allow for more of this chat within groups functionality, I think it's still going to remain a very large problem as to how you monitor and moderate those engagements and protect vulnerable communities and health information.
Thank you, Debbie. And interesting to see some of our attendees are sharing perhaps some solutions in this space in the chat. So keep that going. I want to bring a question to Andy here. One of our attendees asks, what was the feedback received by local governments?
Yes.
As well as how did your initiative, that WHO Health Alert in this case, move the needle on the social impact agenda?
Yeah, so with regards to the governments, that was a tricky one to navigate. WHO is governed by the member states, which is the countries. So they are our board of directors. One thing that we found was that we put out guidance, was WHO guidance in Italian. This is not Italian Ministry of Health guidance. And that was our first big sort of disconnect, because we had guidance around social distancing, we had guidance around hand washing. Now the hand washing was the same. I think we had started off by saying 2 minutes and they said more than a minute. So they wanted us to change to more than a minute. But what we had to go back to them to say is that this is not a bot for Italy. This is an Italian language bot. And this is WHO's bot for Italian speakers all throughout the world. Obviously, 99% of them are going to live in the country itself. So this was our first disconnect. We had the similar problems with Iceland, who are very into their technology, saying that you've got to change the guidance to match our guidance. And we simply can't do that. We have global guidance, and then they put and implement the local guidance. That was the biggest difficulty. The thing that sort of helped us breach that problem was, explaining very simply that this was the case of the global guidance, but also the fact that they were under so much pressure that they were happy for any help, because we were launching as the countries were coming into large outbreaks. What was the second part of your question, Catherine?
I don't know that you will even have time to answer it here, but it was. Well, yeah, around, and I suppose this could be a question for everyone, how your initiatives moved the needle on the social impact agenda. But I think that's a big question. I know we only have about 5 minutes left, and I do want to also bring it back to Gustav and Nelly, who we heard from in the beginning of the webinar. They have a pretty interesting perspective on not only the work that they are actively doing, but the work that they are seeing in the Chat for Impact space, the work that they're supporting. And so I wanted to bring it back to the two of you for final reflections, any calls to action for this community. And I would note, if you had a question we didn't get to, please keep it going in the chat. I see people sharing their LinkedIn profiles, how to follow up. So it seems like the conversation will certainly continue past this webinar. But I do want to bring it back to Gustav and Nelly for any final reflections or thoughts, or kind of a sense of the way forward. Where do we go from here?
So I think that's it's a great segue, and I actually I'm glad somebody asked the 10,000 pound gorilla question, which is impact. In the end, we're doing this to improve lives. I think that we're so early in, and it's with any new technologies like this. When you're in an early stage of launching something, I'm definitely, people know me, I'm guilty of that. As you know, you get excited about any new technology because it can solve some kind of problem, and if all is if you have is a hammer, then everything you see is a nail. Clearly, chat or WhatsApp or chat systems aren't going to solve all our problems. It solves one problem really well, which is it's extremely usable, and we can reach billions of people. And I think we're in that really early stage, and what's really amazing is to see the different directions people are taking with this incredible tool. But it's just a tool, and so we're in the, let's say, the connection stage. And many of the questions tonight were also about this idea of like, how do you build audience? How do you connect? So we're still in that early, almost like you know, we're still making fire. We're not at nuclear power plant stage yet. We're trying to connect to users, figure out the technological problems, which are the easy, really, I think the easy problems. They're fun to solve, they're easy to solve, but they're the relatively easy problems. I think the impact question and the other things that people have mentioned here, specifically the societal issues, the social dynamics, the human component of it. Shahed, the fact that, you know, I think that's the part that we don't understand at all yet. We're so early stage in these things. We're doing such basic services. We're doing them at scale, but I think that's maybe my wish for this audience and for this community is let's try and solve these problems together. The data that Dave was talking about, that points towards a future where we can understand more about the social components of these things, how people will, when they consume information, when do they make changes to their lives, and are their lives better? That's the impact question. But there are also other things here, like why do I believe a message that Catherine sends to me and not that Andy sends to me, and why do I forward it on? We don't know enough of these things yet. Why do I believe mask wearing information and I don't believe information about vaccines? Why am I an anti-vaxxer when I get information from one person and not from another? And I think those questions around news, around belief, around behavior change, and the last point really was around privacy as well. Unfortunately, ease of use or usability is very often orthogonally different from privacy. And so we want to build services that really help people, but they require us to have systems that respect their privacy. And unfortunately, if we want to analyze all this data, we have to have our users' consent. We haven't spoken a lot about that. And I think just some of these things, I think the human elements to a lot of these things. And I'm so glad so many of the panelists have mentioned that, because I'm super excited to see what this group is doing. And there are many, many ways in which we will be, hopefully, in these monthly town hall meetings and I see the LinkedIn profiles, the WhatsApp numbers people are sharing will be the ideas to build a community to try and solve these problems. And yeah, just my last word is thank you everybody for sharing these incredible insights.
Thank you, Gustav. Yes, we covered a lot of ground, but there's a lot we didn't cover. So I'm glad that this is just going to continue on. Nelly, I think we only have about a minute left, and I'm not quite sure if we're going to get kicked out at the end of that minute, but any final reflections or thoughts on where we go from here?
No, thank you, Catherine. I think this is less than a minute. I think this was really insightful, and it really brings more questions than answers, which is always a good sign, and leads gives a vision moving forward to stay pertinent, to put the user at the center and learn how to pivot around the way. And the great thing about Chatbots for Good is that it keeps us continuously innovating and changing.
Well put. I agree. I'm coming out of this with many questions, but I know the conversation will continue. I believe we are at time. I know we're going to put up a slide about how you can connect moving forward. So here are some ways to connect and continue that conversation, in addition to all the connections formed here in the chat. But I certainly learned a lot in this conversation. I hope you all did as well, and thrilled to see that our attendees are actively sharing with one another. We're not just looking back and reflecting on the past 9 months. We're very much in this still, and people are continually learning. So thank you to Turn and Fundación Capital for bringing this group together today to share these learnings in the midst of crisis, and hope that it can lead to some real impact in response to COVID-19, but also as groups move forward, that they can leverage chat and messaging to reach the people they want to serve and continue their mission. Thanks again, everyone, and looking forward to following your work.
Thank you so good. So much.
Thank you. Thank you.
Thanks so much, everyone.
Bye-bye.
Take care.
Stay safe.